right, I want to show some myofascial cupping for knee pain. And this is a recap. I did a detailed lesson in the class, but I want to just kind of both demonstrate and recap a little bit. So I liberally apply oil, or lotion, cream in this case. And I've already palpated to feel where she's tight. And then I will modulate the amount of suction depending on how much I squeeze. The more I squeeze, the deeper the suction. The less if I start with less squeeze, it's more mild. So I'm going to start off a little bit more mildly. How's that? You know, from person to person, it's going to be different. But generally, if you work all of the origins insertions that impact around the knee, or underneath the lower part of the IT band, how's that? Mm-hmm. Okay. Mm-hmm. Use a little. So what I'm noticing with my own hand, I didn't want to do super strong pressure, so I was squeezing it so I didn't pull all the way. But since I want to be kind to my own hand, I'm just going to downgrade to a smaller cup, which has a little less pressure. And then I can let it come out completely. Then my hand is free to just glide. Is that too much? Mm.
Definitely feel it.
Yeah. There you go. So I'm in treatment mode. I would spend some more time. You can already see. Can you see how some of the flesh and the blood's coming up, improving circulation, right? And I'm gonna just for the sake of this video do a bit of a recap. And then I will work with her more thoroughly when the video's off. But you can also do the lower leg area. Also, this area along here is really good to help with people with shin splints. And it's often really important. May I take your sock? Yes. Okay. So I often will keep a hand towel close by, but if not, you can use any piece of fabric to keep the skin taut while you glide. It's more comfortable for the receiver, and you will get more control than if you left it too loose. Keep it taut. And we'll show also, often with the IT band area, I'll just do a lower section for right now. It's an area that's more intense to receive. So sometimes what I'll just choose to do is do a stationary cup. Or a couple of them. That. Let them work a bit while maybe doing some other gliding work. If you find that there's a given area that's a little bit too intense for the receiver to receive, I often will just say, let's say I was working here and it was just too intense. I would place it and let it sit. Now areas where there's things like spider veins, you're not going to want to do much drawing so it does not enhance them unnecessarily. but you can get along the edges of the bone. Want to make sure to keep a good amount of glide. That helps with both the suction and then also helps the glide, and also not to pull the hair or the skin too uncomfortably. And the great thing about the silicone ones is they're better for working around bony landmarks because they've got a little give. And sometimes I will use the edge to kind of press down, similar to doing something like gua sha, and then sometimes I'll pull up and not be using the edge to do cross fiber friction. So they're all a bit of an option. And you can just also just do some gentle circling like this to encourage mobilization, gentle in between the muscle fibers. You like that?
It's interesting.
Yeah, it's interesting, yeah. So that's the recap for some of the myofascial cupping for the knee. Enjoy.